Hello, guys. Welcome to another episode of the Anti-Pharmacist podcast. So, it was my birthday yesterday, and I had a lot of wishes, from friends and family. It was a very great day. I'm still, basking in the euphoria even till now. So, I want to say thank you very much to everyone that wished me, post messages, gifts, prayers. I thank you very much, and I love you all. So, on today's episode of the Anti Pharmacist podcast, I'll be talking about a particular topic that you might not expect, but I believe that it's important that we talk about it, and that is the control medications. I want to tell you why the fuss about control medications in Nigeria. Why do we always insist that you bring a prescription to the pharmacy when you want to get some particular medications? So I want to break it down for you today, what over-the-counter medications are and what controlled medications, otherwise known as prescription-only medications, are, so that you don't fight your pharmacist all the time when he or she insists that you get a doctor's prescription before they can dispense particular medications to you. So let's get right into it. Well, you might have walked into a pharmacy at one point in time where you just asked for a particular medication and this pharmacist insists that you get a prescription before getting it. I've had a lot of patients come in, to demand for prescription-only medications over the counter. And I feel like, well, it's because they are not aware. And that is why I'm making this podcast, so that you can know the difference between prescription-only medications, controlled substances, and over-the-counter medications. The major focus of this podcast this morning is the controlled substances, the controlled medications. There's a reason for it, and that's what I'm telling you today. So, prescription-only medications are medications that you can only get after you have tendered a doctor's prescription. That is, it's only a doctor that has the right to write it down for you. You have to present a duly written prescription by a qualified medical doctor, signed and dated appropriately. Even the prescription has to be written appropriately before it can be honored at the pharmacy. So a few definitions, alright? Over-the-counter medications are medications that you can just walk into a pharmacy and get. They usually do not require any prescription, and most of them are pain medications. They are your NSAIDs, they are your paracetamol, antihistamines, medications that you can just get without having to visit a doctor first. Alright, you can self-diagnose. Maybe you have a pain somewhere, you have headache, you can walk into the pharmacy and demand for these medications. No pharmacist will ask you for anything. They might ask you a few questions to know the appropriate ones to give you. If you walk into the pharmacy and ask for a pain med, they might go further to ask if you have ulcer or not, because you may not know which one will be suitable for you to use. Do you understand? That's about over-the-counter medications. They are easily gotten, no need for doctor's prescription. But prescription-only medications are medications that you cannot get, that should not be dispensed unless you have tendered a duly written, signed and dated, properly written prescription by a qualified medical doctor. Now, prescription-only medications are divided into two. There is the controlled substances and those that are not controlled. Controlled medications are ones that, of course, they have to be prescribed by a medical doctor, but even the dispensing is controlled. It's not dispensed anyhow. Even a doctor cannot prescribe a whole sachet of diazepam to you. You cannot bring a prescription in which the pharmacist has to dispense about 5 sachets of diazepam to you. No pharmacist will honor that, because it's a controlled substance. It's not supposed to be in abundance with the patient. You are supposed to get the exact number you need for the exact number of days. So also some other drugs like Odamol and some injectables like pentazocine, you're only supposed to get what the doctor has prescribed for you. That's why you see pharmacists taking scissors and cutting some tablets out of sachets, and you'll be wondering that what are these people doing? It's because they are controlled substances. It is different from other prescription medications like antihypertensives, antidiabetics. Of course, they are prescribed, drugs for heart failure, because it's only people that have these conditions that can use them. Nobody just walks in and starts getting this medication unless they have seen a doctor first. Only in rare cases will a pharmacist recommend them without the patient seeing a doctor. So in those cases, if you need it for 7 days, for example, we can give you a sachet, because a sachet maybe contains 14. You can have some left at home. But for controlled substances, you get the exact number of tablets you need for the exact number of days. So don't let it surprise you when you see pharmacists taking scissors out to cut drugs in that regard. Now, I've had altercations with a lot of patients concerning this prescription-only controlled medications. They come in thinking that I'm the enemy because I don't want to dispense to them without a doctor's prescription. But it is because these medications have abuse dependence. They have potential to be abused, and some patients do not even know it. They get so addicted to it that once a doctor prescribes it to them, for example, let's take for example diazepam, the common one that they call Valium 5. A doctor says that, okay, this patient has insomnia, cannot sleep, maybe this patient has elevated blood pressure, they have to bring it down, and they gave this diazepam as an adjunct, not a blood pressure medication this time, an adjunct to actually help the patient relax, since it's an hypnotic, right? Now, for a number of days, say 5 days, every night, the patient finishes this medication, sees that, oh, they slept so well, and when they check their BP next time, it was well controlled. Now, they go behind the doctor's back, going to pharmacies to want to buy this medication to start using with their other medications. This is wrong. I've had a lot of problems with patients concerning this. It is not done anywhere. Use it for the number of days the doctor has told you, continue your normal meds, do lifestyle modification, and you sleep normally. You'll be fine. Your insomnia will be gone. Not that you now have to keep taking it. Although I don't blame some patients, some actually do not know. They actually think that it is something they have to keep refilling each time it finishes, which is why I would advise medical doctors, my colleagues in the healthcare profession, to educate their patients so that they don't get to the pharmacy and start fighting pharmacists. Tell them, this medication I'm prescribing to you, take it to the pharmacy. You are using it for a number of days, after which you do not need it anymore. So that the pharmacist will stop, explaining. Then, when they bring prescriptions to the pharmacy, if it's a controlled substance, you are supposed to drop that prescription, because we have documentation system in which that prescription must appear. We must take it from you because we want to prevent you from taking it elsewhere to get it again. It's the law in Nigeria. I'll still talk about pharmacy laws later on this podcast, and you would understand better. The aim of this podcast is to make patients and pharmacists be on the same page so that we understand each other, to solve issues that cause a lot of altercations and misunderstanding in the healthcare space. And this is why I'm bringing this one to you today. Now, I've talked about controlled substances and I've done a lot of explanations. I hope you understood up to this point. Now, I will let you know why the substances are controlled in the first place. I've told you that they have abuse potentials, but what they actually cause is addiction. So I'll be defining what addiction is, and I'll be telling you the categories of drugs that are in this class that are controlled. According to American Society of Addiction Medicine, addiction is a primary chronic disease of brain reward, motivation, memory, and related circuitry. Dysfunction in this circuit leads to characteristic biological, physiological, social, and spiritual manifestations, and it is reflected in an individual pathologically pursuing reward or relief by substance use and other behaviors. Addiction, although, is now termed use disorders, and it is characterized by inability to consistently abstain, craving the drug, impairment in behavioral control, diminished ability to recognize significant problems with one's behavior and interpersonal relationships, and a dysfunctional emotional response. It is like a chronic disease, and it involves cycles of relapse and remission. So without treatment or engagement in recovery activities, addiction is progressive and can result in disability or premature death. So people that use these particular things, they have this craving for it. After they are addicted, they want to always have it. If they don't, they show some behavioral malfunction manifestations, and they have withdrawal symptoms that they are not okay if they don't take this medication. This is not how to live. And like I said in a previous episode, crack, cocaine are not the only things people can get addicted to. You can get addicted to as simple as pain meds if care is not taken. Let me quickly go over the 5 characteristics of addiction again. Number 1 is craving for drug or reward. You want that drug no matter what. Number 2 is diminished recognition of significant problems in one's behavior. You now get aggressive when you come to the pharmacy and the pharmacist is insisting on a prescription. You get defensive and you don't even know that what you are doing is wrong. Number 3 is dysfunctional emotional response. 4 is impairment in behavioral control. And 5 is inability to consistently abstain. Even if you go without it for a few days, you find all means to get it again. Controlled substances are divided into 5 schedules according to the National Drug Enforcement Agency in the US. Like I said, US is the standard for most of these things. This include Schedule 1, which are drugs that possess the highest potential for use disorder and misuse. They have no medical use and they are illicit or street drugs. Examples are heroin, LSD, mescaline, MDMA, and the rest of them. Marijuana also, well, now it is legal in some states in the US, but not in Nigeria yet, so it's still an illicit drug in Nigeria. Schedule 2 includes drugs that have reduced potential for use disorder than the Schedule 1, although they have high risk for both physical and psychological dependence, and they have high capacity for both use disorder and misuse, but they are typically prescribed to treat severe pain, anxiety, insomnia, and ADHD, which is attention deficit hyperkinetic disorders, like fentanyl, methadone, morphine, phenobarbital, pentobarbital, dextroamphetamine. Those are examples. And no refills are allowed for these Schedule 2 drugs. Schedule 3, they have lower misuse potential than Schedules 1 and 2. They also can cause physical dependence, but they more commonly lead to psychological dependence. And the medications in this category are often used for pain control or anesthesia or for appetite suppression. Examples are ketamine and anabolic steroids. I talked about anabolic steroids a few episodes back, how they can become addictive due to abuse. This is it, they are in Schedule 3. And opioid analgesics are also in this schedule. The likes of codeine, tramadol, pentazocine, they are in this class. And a lot of people, even in Nigeria now, they are addicted to these medications. Some even come in, with fake prescriptions. I've caught like 2 people like that, I must tell you the truth. They impersonate doctors, which is why doctors have to be extra careful. A while back, on my WhatsApp status, I posted asking doctors on my timeline how they control prescription pass in their premises, because I saw a lot of people come in with prescription impersonating doctors. I see names of different doctors from the same person with the same writing. They come in to take these medications and they use it on themselves. Some buy needles and syringes to inject themselves. That is addiction. And the thing is, even when they were caught and I confronted them, these people kept coming back. Imagine. So you see what I talked about, psychological dependence, change in behavior. A normal person will not come back to that place because of course they've been caught. But no, they still come back and prove that no, they were not lying or stuff like that. It's so sad. It's better to not get addicted to these things, because when it starts, you may not even have control over it. Now to Schedule 4 drugs. They have lower misuse potentials than the previous schedules that I've mentioned. They have limited risk of physical or psychological dependence, alright? But still, they can cause addiction. Mostly the drugs in this class are utilized for pain control, as long as the healthcare provider deems the drug medically necessary and the benefit of taking the drug outweighs the risk. Alright? Examples are your diazepam, clonazepam, lorazepam, tramadol, they are in this class. Refills are permitted up to 5 times in a 6-month time frame. from the insurance state. These are laws according to the US, and mostly, like I told you, Nigeria adopts this law. All right. And Schedule 5, the last schedule, contains drugs that are least likely to be misused. They result in limited physical or psychological dependence. An example include cough medicines that contain codeine, anti-diarrhea medications that contain atropine, pregabalin, and despite their low abuse potential, they still need to be managed appropriately and administered with care. When they contain codeine, it must be less than 200 milligrams of codeine in 100 mils. Now, let's talk about this codeine thing. A lot of guys come in for all these cough syrups. They'll be asking for ones with codeine, but thankfully in Nigeria, they have been banned, although I am very aware that some people still sell them illegally. How they get them, I really don't know. But NAFDAC is working day and night because of these kinds of people, because they are creating problems in the society, abuse dependence everywhere. Young guys being addicted to cough syrups because of codeine. And now I noticed the pattern that guys are switching to cough syrups containing diphenhydramine. Diphenhydramine is an antihistamine, but it has a side effect of causing drowsiness, like serious level of drowsiness, something similar to what codeine causes. And this is what these guys are capitalizing on. Now they come in asking for codeine. I'm like, does codeine contain codeine? So I came across a term called prescriber shopping. Like I said earlier, this abuse dependence makes these people aggressive. They just want the drug at any cost. So they do something called prescriber shopping. They already know the kind of symptoms they should list in order to get these drugs. So they go from doctor to doctor, presenting different kinds of complaints just so that they prescribe these particular medications to them. They go over and over again, either to the same doctor or different doctors. So doctors themselves have to be extra careful, because this patient might just be lying about their symptoms just to get the prescription of these medications from them. That's why psychology is part of medicine. It's another episode I'll be bringing on this podcast, how psychology and medicine relates. So a lot of patients, they are so desperate for it that they come up with fictitious signs and symptoms, complaints, just so that the doctor will prescribe this thing to them. So we as healthcare professionals, we have to be very careful. And again, I want to reiterate and emphasize that we are not being wicked by not giving these medications out. I've told you the different things that they cause. They increase crime rate in the society. Go look at other societies where people take these things at will. The rate of crimes there are so high. It is not what we should bring into this country with the rate of the problems that we already have here. That is why when you go to your pharmacist and they are insisting on a prescription, it's for your own good. It's so that you don't live your life dependent on a drug and become an addict. For what? These are things that, is it insomnia you have? There are things that can be corrected naturally. If you need the medication, use it for a limited time, then stop it. You should be weaned off it and do it naturally. If it's to suppress your appetite, there are fiber-rich foods to do that. If it's to build muscles, we've talked about ways that you can do them healthily. Abuse of drug is not good for your body. A lot of problems it causes. Number one is organ damage, apart from other things that we've mentioned earlier. So please don't see us as your enemies when we insist that you bring a prescription for your medications. It's for your own good, and we explain to you how to use it and for the number of days. These things have limited use, limited days that you should use them. They are not to be used indefinitely. They are not your over-the-counter medications. Even over-the-counter medications are not to be used indefinitely, because every single drug has a side effect, no matter how beneficial that drug is. And the side effect has, impact on the body system, on the organs. We are here to help you. It's for your own health. So this is the first about controlled medications. So let me conclude by this review that was done of multiple studies to demonstrate ways by which individuals obtain these prescription medications, these controlled substances. The survey showed that 55% get from friends or relatives. These are not medications to share. Don't say that, this V5, this Valium, my doctor prescribed it to me when I couldn't sleep. Oh yeah, my friend, take it. This your friend can get addicted to it. Like I said, you should only get, under normal circumstances, you should only get the number of drugs you need for that period. If your doctor prescribed it for 3 days, you should only get 3 tablets. So you should not even have any left to give to your friend. 20% comes from prescribers. Like I said, a lot of these people, they are so notorious that they do prescriber shopping. They go from doctor to doctor, coming up with fake symptoms just to get this medication. So doctors have to be on their toes. They have to be very vigilant. 10% were purchased from friends or relatives, like purchased, used money to buy. Imagine. Now this is going to the level of the Schedule 1 controlled medications, like the cocaine, like the marijuana. They purchase them. Of course, 5% stolen, percent purchased from a drug dealer, 2% from multiple doctors, the prescriber shopping I talked about, and 1% from thefts from medical practice or pharmacy. Of course, people come into pharmacies to steal, but thanks be to God, thank God that here in Nigeria, these medications are kept in separate places that nobody should access. Not just anybody can just pick it and steal it. But then again, we have pharmacy staff, and they could just be friends of some of these people that are addicted. I'm just saying in reality. So it could happen. And we as healthcare professionals too, it's our duty to safeguard the health of our family, of our patients. So it's not right to take these medications, because I have access to it and I'm a pharmacist, now I can give it to my friend that has insomnia, and to just use like that each time they can't sleep. Let me just take 2 or 3. That is wrong. Or myself as a pharmacist, I can't sleep, I know that this is an hypnotic. You are abusing the medication yourself. So I'm not just talking to patients here, I'm talking generally to all of us. And less than 1% obtained from the internet. So this is what this survey shows. And this study also reveals that the source of the majority of these drugs was a single legal prescriber. That is why prescribers, the medical doctors, have to be extra careful. Some of these patients just use you to abuse these medications. Of course, as long as they come to the pharmacy presenting a legitimate prescription, the pharmacist is bound by law to dispense. So a lot of people come in, yes, it's my doctor that prescribed it. Some just call their doctor friend on the phone. My friend, I can't sleep. Oh yeah, now let me write a prescription for so. And they, being the friend, now not in the professional capacity, because if they use their professional judgment, they should know that this is wrong. But okay, he's my friend now and he needs D5. Even though I'm not his doctor, but because I'm a doctor and he's my friend, oh yeah, write a prescription of diazepam for me. And you write it for your friend just to take it. It is wrong. These things, there are reasons for it. Abuse dependence is no joke. When you see an addicted person, you will not pray to be like them. So please, my people, let us be cautious. Let us use medications with wisdom. Medications are foreign substances in the first place. God has designed our bodies in a certain way. Medications are meant to correct pathological conditions. You should not use them when you are not sick. You should not use them when you do not need them. They have effects. I keep saying it again and again. So this is why there's a force on controlled medications in Nigeria. And it's not just in Nigeria, you see, it's all over the world. Medications are being controlled all over the world, especially ones that are dangerous to your health. These controlled medications I talked about today have abuse potentials. You should not use them anyhow. Please, and please, when you have any abnormal, condition, any medical condition, see your doctor. Doctors are professionals. They know what to prescribe to you. Don't start telling your doctor that I think what I need now is Lexotano. I've not been able to sleep. Or I was given one time like that and I slept well. Please prescribe it for me. I even trust our doctors. They cannot be influenced by patients that way, because they did not go to medical school to be directed by patients what they should prescribe. So please, my people, let's be careful about our use of medications. Controlled substances are not a joke. And I've explained to you today on this podcast why we tell you to bring your prescription each time, and why we keep this prescription after we have dispensed to you. Please, no vex, let's follow the rules. It's all for our own good. And that is the end of today's episode on Anti-Pharmacist Podcast. Thank you so much for following up till now. Thank you so much. We are encouraged to continue to bring you medications information from a trusted source. Please follow us on Instagram. Also, make your comments, ask your questions as usual. Contact us via email at anti-pharmacistpodcast@gmail.com. And another addition, now you can follow us on Twitter. Oh, it's now called X. You can follow Anti-Pharmacist Podcast on X. You see Anti-Pharmacist at Farm Podcaster. Please do follow us. We plan to put posts also on Twitter. This podcast has to get everywhere because everybody needs medication information. Till next time, stay healthy. God bless you and enjoy the rest of your week.